So today I'm going to be demonstrating complex wound care on an abdominal wound. So first thing I'd be doing is I'd be reviewing my physician's order sheet and gathering all my supplies, making sure that the package, all the package integrity is intact and that no packages are expired. And so I'd be gathering all my supplies and heading to the patient's room. So before that, I'd just be making sure that my patient gets analgesia and that it has time to get to the peak effect before we start the wound care on the patient. So as I'm entering the patient's room, I'm performing hand hygiene. I'm doing my entrance safety check, making sure the bed's in the lowest position, the patient's not in any distress. So as I'm walking in the room, I'm introducing myself. So my name's Caitlin Knockert. I'm going to be your student nurse today. So I'm just getting the patient to verbally confirm their name and their date of birth. So on their wristband here, I have Jason Smith, and their birthday is September 16th, 1975, which matches what they told me, so I know I have the right patient. Okay, so I'm just going to be letting them know that the doctor ordered a dressing change on their abdominal wound, so just letting them know that we're going to be taking the dressing off, we're going to be cleaning the wound, and that we're going to be putting a new wound or a new dressing on, and just asking if now is an okay time for us to do that, and they say that it is, so we have their consent, so we're going to get started. So I just did my hand hygiene, so I'm going to start setting up my sterile field. Making sure only to touch my 1-inch border. Okay, so I like to throw that in the garbage because I don't need it. Okay, so I'm going to get started adding supplies to my sterile field. So on my physician's order sheet, it had said to pack the wound with normal saline, moistened Kerlix, and to cover it with 2 4x4s and with Mefix tape. So I already have pre-cut my Mefix tape. And also, just because of past runs of the demo, my Kerlix is already pre-cut. So I'll demonstrate what cutting it would look like, but I don't actually need to cut any because I don't have extra to spare. Some of my cotton tip ends might be a little bit moist, and so might my gauze be. So I'll keep an eye out for any moist spots, but they're, like if I actively drop water on my field, but if there's some wet spots, it might just be because of pre-wet supplies, so in which case my field isn't actually compromising sterility, but. So I'm just noting I have a couple drops here just from before, so I would just keep a 1-inch border around and away from that area. So this, I would have made sure that it's sterile, hadn't been opened before, and that it's not expired. Okay, so now that my sterile field is all set up, I perform hand hygiene again. And I'm gonna apply clean gloves. So I would just let my patient know that I'm going to start the wound care now. So we're going to start taking the dressing off. So I would just be noting how much exudate I have on either of my gauze pads here. So I would just say I have, let's say there's about 30% saturation of serosang exudate on my first gauze and 25% serosang drainage on my second one. Just noting for my wound documentation for later. So I'm going to use these forceps to pull this out of the wound bed, So again, just noting how much drainage is on this. So let's say there's about 50% saturation of serosang drainage on this Kerlix. So I'm going to dispose of that. And I would just be noting the wound odor as I'm taking off the dressing and what it smells like. So let's say the wound odor is normal. So I'm going to dispose of my clean gloves. I'm going to perform hand hygiene again. And I'm going to don my sterile gloves. Okay, so now I'm going to get started. So I'm going to start with cleansing the wound. Okay, so I'm going to start cleaning from the center to the outside, going from clean to dirty, making sure that the solution runs clear. So that it's all clean there. So now I'm going to start with drying the wound. So I'm just doing the little overhead taco method there and just making sure not to touch my forceps into the wound bed, but soaking up all the extra water. So we're going to do that one more time. Get all the extra water. Okay, so now I'm gonna clean my peri-wound skin. With my little rosettes. Okay. So I'm going to go one swipe per wipe, like that. So in a real clinical setting, I would clean a greater area of my peri-wound skin, but just for the purpose of demo and for the sake of time, I'm just going to do two 2x2s, one on either side, just to show how, to clean it. So another swipe. Okay, and now I'm going to dry it. So I would make sure that I at least probably have a couple inches of extra room there of cleansed skin, just in case if I drop Kerlix on the peri-wound skin, just so that that area is considered sterile. Sorry, I'm not gonna wet it, I'm gonna dry it there. One swipe. And on the other side. So now that my wound is cleaned, I'm just gonna do my assessment. So just getting an approximate length. So we'll say that's 11 centimeters in length. And just doing my width is about 2 centimeters. And so now I'm just checking my depth, which is about 2 centimeters. And then I would just probe around in the wound bed for any signs of tunneling or undermining, which there isn't any. Okay, so then I'm just gonna finish the rest of my wound assessment. So just checking my peri-wound skin is not red and it's intact. My wound edges are well approximated, they're not rolled. The wound tissue looks healthy, there's 100% granulation tissue, and it looks like it's healing well. So then I'll just be asking the patient if they're having any wound pain while we're doing this procedure, and they say that there aren't, so it's well controlled with the analgesia. So I'm just noting all those parameters for documentation, and we're gonna start packing. So I'm just soaking my Kerlix. So I'm just gonna grab my cotton tip here. There we go. So now I'm gonna start packing the wound. So again, if my Curlix touches a little bit of the peri-wound skin, that's okay, because I would have cleaned a large area around the of the peri-wound skin. So whatever area that I cleaned is considered sterile, so it's okay for the Curlix to touch that area. So at this point here, I would just be grabbing my scissors. So I'm just noting that on my sterile field, I have this little spot there. It's an inch away from my gauze there, so that's okay. But I would just be noting to not put anything in that area of my field. So my gauze is still sterile because it's at least an inch away. So I would be here, I'd be cutting my Curlix and then putting my scissors off to the side. And I'm gonna finish packing. So I'd just be making sure that all the areas of the wound are covered and it's flush with the skin, which it is. So now I'm going to take these two gauze, my 4x4s, and I'm gonna apply them to the wound. Just like that. And what didn't come anywhere within that area, so we're still good. So now my hands are considered clean. So I'm gonna apply my knee fix here. So it would stick a little bit better on an actual person, but okay. And this is okay that it touched this area because this is clean, not sterile. Okay, so then at this point, I would be cleaning up the rest of my supplies. I'd be doing my exit safety check. I'm gonna dispose of my gloves. I'm gonna perform hand hygiene. So just be making sure the patient's comfortable. I would do the rest of my wound documentation, so just making sure that I'm documenting on my IPN sheet and my wound flow sheet, clearing out my supplies, and done.